My name is Eric de la Fortelle. I'm born French and became Swiss in the meantime. I started as an engineer and a scientist in France, and I did a PhD in biophysics, precisely the shape of proteins by X-ray crystallography. So that was my scientific period. After that, I did some research as a postdoctoral scientist, and then decided to go back into private enterprise via an MBA, and doing 15 years of licensing in biotech companies, in pharma companies, including 6 years at Roche in Basel, where I still live today. And after my 15 years, at the end, I was CEO of a biotech company, which gave me the taste of interacting with investors in this entrepreneurial world. I became an investor myself about 10 years ago, worked 7 years for Venture Partners, and now working for Cathay Capital in the Cathay Health Fund since September 2021. The most impactful development is a negative one. It was the SARS COVID epidemic, which really led people to understand first how difficult it is to have a new health product, how difficult it is to interact with the healthcare system in the absence of normal communication channels, accelerated the whole digital world, and also showed the importance of data. Without the data coming from the Chinese initially sequencing the virus, we would not have vaccines today. So the whole sector was boosted by this negative. Of course, I could quote other things such as the first approvals, regulatory approvals of gene therapies, and the whole wave of RNA therapeutics, which was in preparation for the last 20 years, but is now really happening. Yeah, the current economic climate is not favorable to taking risks. The big difficulty is how to propose something that is innovative without it looking too risky. So let's say, in my case, I'm a managing partner at a fund. We need to raise funding for this fund. We need to show that our way of generating investment opportunities, our way of implementing it, selecting companies, having a portfolio theory that reduces the risk of the whole portfolio, this is what we need to demonstrate to the investors in our fund. At the level of individual companies and entrepreneurs, they need to demonstrate that they are taking the least risky path to the development and commercialization of their product, and they need to show that their product is not a beautiful, expensive, cutting-edge product. It needs to be beautiful and cutting-edge, but its cost effectiveness needs to be demonstrated. So entrepreneurs today, be they in digital health, be they in medical device, be they in drug development, the first thing they have to do during their clinical studies is to have an economic analysis to say, with this product, you will have better care at a lower cost. This is what really needs to be done today. More difficult times call for inventiveness in economically sound solutions. So in Europe, there is a lot of inventiveness in the scientific side, a lot of solutions. I'll take the field of surgical robotics, for instance. I think over 70% of the new surgical robots have been originally invented in Europe. Some of them have gone to be commercialized in the US, some of them stayed in Europe, and most have become global. What's really important in Europe is that the customer becomes more modern. So when the customer is a hospital system, when the customer is a doctor's office, these customers are behind in the adoption of new products, of technologies, of innovations. And we, as the entrepreneurs and investors, need to convince them that new technology will not make their lives more difficult, that it is going to make their lives better for their patients, better for themselves in terms of their quality of work, and economically effective. So their bottom line will be positively affected by our products. This needs to be done, I think, everywhere, but mostly in Europe, and it's our job to go out and convince. Number one advice is know the person in front of you. So having done 20 years of business development, partnering, negotiations, the most important thing I learned in my job is I need to look at myself with the eyes of the person in front of me. So you can do that in a negotiation. That was my job. You can do that when you talk to your investors. So understand what are the pressure points of the investors. Understand the cycle of raising, investing, and liquidating a fund. When I was a CEO, I did not understand that. I had difficulties talking to my investors. Don't do the same mistake. And then, if you develop a product, the same applies for your customers. Is your customer a surgeon? Is your customer a prescriber? Is your customer a nurse? In all of these three cases, if you haven't spent days and weeks and months shadowing your customer, understanding what their daily life is made of, the glories, the miseries, the administration, everything. If you don't understand that, your product will not be the best possible. So understand your customer, take the time, have co-founders that come from the same community as your customer, spend time, educate your company, have the company culture that is totally dedicated to the customer, and do not idealize your customer. A medical doctor is like anyone else working in an organization. They have their constraints, they have their miseries. These have to be taken into account. When you develop your product, sell it to them, it needs to be useful to them in the real world, not in some ideal imagined world. So Tech Tour, I would say three things. The first one is that Tech Tour is a beautiful landscape. I'm not talking about the Lake of Geneva or Lausanne. I'm talking about the landscape of all these companies who trust Tech Tour and send their information to them. I've been lucky to review lots and lots of companies to select what we thought were the best ones, but the landscape is amazing. Even the ones not selected for the conference are super interesting in many ways. So the landscape is the first thing. The second thing is the community. The cocktail is just out there, and the community is really nice. To meet people year after year, the returning attendees, the new attendees, and all these people who are part of the ecosystem in some ways. There are the lawyers, the investors, the entrepreneurs, the bankers, and we all contribute to doing something. So the community is important. And thirdly, let's not forget that we do capitalism here for the good. It's a market. And you can see it in the market. You interact with people, you like people, etc. But at the end of the day, somebody is going to sell something to another person. And Tech Tour is, in a very nice way, a very efficient market. You bring selected people to other selected people, and you think better things will happen. So these three things for me is what makes Tech Tour very different and remarkable. I think celebrate success. Tech Tour has done great things. They need to continue innovating. Tech Tour is a very innovative structure. They shouldn't take comfort in we are innovative, let's stay how we are. Continue to innovate, continue to delight the companies, the investors, the corporates, and everyone else in the ecosystem, and keep going for another 25.